other periodontists that I'm talking to will ask me questions like, how do you do a Zoom consult? How is that even possible? So, is it possible? How does it work, Erica?
Absolutely. It's very possible in our eyes. Our patients get set up. First, they have their initial point of contact. They get set for their Zoom consultation with us, and it's super exciting. It's honestly as easy as having an in-person consultation. We go through our process with them. We introduce both of our doctors. We have obviously Dr. Daniel Northhook, our surgeon. We have our other awesome restorative doctors. So we kind of explain it while he goes below the gum line. So anything as far as surgical extractions, implant placement, he is your expert. As far as she goes, she is going to be your expert as far as aesthetics, looks, the feel, the comfort, functionality, making sure that you're able to, live your life just as you normally would. It's nothing outside of the normal. And we have
it's sort of like there's like a cheat code almost of when we get to see a patient either in person or on Zoom, many times this dentistry would not be possible doing Zoom consults and doing things the way that we do. One of the things that we do that's very important to us is, generally speaking, we don't put them in a chair, right? And that could seem a little cavalier and crazy and scary. But for the most part, what I've found through the 13 years I've been doing this is that patients that need full arch, patients that need full set replacement generally kind of can identify that they need that, right? It doesn't take them a doctor in a white coat with models and impression and poking around in their gums to figure out that those teeth need to come out. And so what's nice and what I call it a cheat code is two things. One, we can have a conversation with them via Zoom, and you can pretty much confirm that needs to happen. But two, we get to create an environment where there's really no judgment, right? Absolutely. And so you're sort of that first person. You're the smile, that sort of no judgment-free zone. I already kind of mentioned it, but we don't go poking around in the patient's mouth in the first time if they do show up in person. The reason for that is we're not here to make patients feel bad. They already know that their teeth need to come out. They've already done the majority of the research. This has kind of gotten past the tipping point. Now, this would be separate and different if I was doing consults for patients that needed a filling, right? I can't diagnose or tell if they need a filling, sometimes even when you're in the mouth, right? Absolutely. Sometimes it's difficult to discern that. This is a much bigger, different thing. And so what's great is patients will generally either come in with some knowledge or without knowledge, but this generally being the consult is a opportunity for us to kind of almost like sitting in a living room or having this conversation. It's about the same size room, and we try to make it comfortable and warm. Personality is part of that, but also sort of the aesthetics, right? We have carpet, it's quiet, it's kind of warm and sort of comfort feeling. Yeah. And in that way, we get to have a very like one-on-one conversation with them.
Yeah, it's something that's very personable. I think it's almost not even like selling any sort of product. It's essentially introducing our team. I always like to tell everybody that, it's a huge procedure, mentally, financially, physically. So the most important part of it is that this is your journey and we are part of it and we are here for you. So we want them to feel comfortable no matter where they go, honestly, whether it be with us, anyone else, whatever it is. We want to make sure that they leave us feeling confident.